This video helps to tell the difference between the symptoms of indigestion or stomach cancer. This is how digestion works. So food passes from the mouth, through the pharynx, down the gut, into the stomach, where the food is broken down by enzymes for absorption, while the rest passes through the bowel. So you can experience symptoms anywhere along this passage. So these are the symptoms of indigestion: burping, heartburn, feeling full and bloated, nausea or feeling sick, excess saliva in the mouth or an acidic taste. Now if you had just simple indigestion, I would not expect you to have these other symptoms. Difficulty swallowing for solids, liquids or both. You might get a constant feeling of food stuck in any region from the throat to the upper chest, or not feeling liquids going down easily, and this could be a sign of obstruction from a tumour. Vomiting. This can happen especially after meals, and if there is a blockage in the gut passage, you can also have blood in your vomit. Bloated or feeling full easily after meals. After a few spoons of food, you feel full already. This is a sign that there could be a blockage in your passage. Persistent bloating. You feel full all the time, whether you're eating or not. With indigestion, you feel full after eating, and this tends to go down eventually. Stomach pain. If you have pain for more than 4 weeks that does not get better despite lifestyle changes or taking indigestion medication such as Gaviscon or omeprazole, then you should see a doctor. Stomach pain radiating to the back might be due to an ulcer, but can also indicate spread of the cancer to other parts. Stomach pain at night. This is not common with indigestion and is a crucial warning that something else is going on. This can be due to an ulcer or bacterial infection, but can also be a late sign of stomach cancer, so do not ignore the symptom. Loss of appetite. This can be due to difficulty swallowing, feeling full easily, so it puts you off eating, or you simply just don't have any appetite. Weight loss. This can be due to loss of appetite, or you're eating as normal but still losing weight. Like stomach pain at night, this is another late sign. Change in stool colour. You might notice your stools are black or darker than normal. This would usually present with some of the other symptoms mentioned. Looking pale. People might notice you look paler than your normal complexion. This can be due to anaemia and can be a sign of blood loss you might not have noticed in your stool, as well as your body not producing enough red blood cells. Fatigue. You feel constantly tired all the time. Again, a sign of anemia or that your body is not absorbing any nutrients. These are signs and symptoms that might tell you this is not just simple indigestion, so do not ignore them, and you should be seen urgently by a specialist for further investigations. An endoscopy is a test that will detect stomach cancer which shares similar symptoms of indigestion, especially in the early stages. This is a camera test which involves passing a long, thin, flexible tube with a light and camera through your mouth and into your stomach. At the same time, small tissue samples of the stomach wall can be removed for further testing, known as biopsy, to look for the presence of abnormal cells. Your specialist might also want to carry out further tests such as blood tests, stool tests, barium swallow, ultrasound, CT or MRI scans, as well as explorative surgery to look for any spread to areas such as lymph nodes. To learn more about cancer awareness, please share and subscribe to my channel.